Good evening, everyone. This is board-certified neuropsychologist Dr. Karen Sullivan with you again. I normally come to you on Wednesdays at 6, but this week I have to come a day early because I'm going on vacation tomorrow. So I did not want to miss a week of our free science-based brain health lectures. And this month we are focusing on stroke. My goal is to increase your access to science-based brain health information because I think it truly makes a difference in recovery, in how empowered you feel about going forward with your coping and living and thriving with all sorts of brain health conditions. What we're going to talk about tonight is something called secondary stroke prevention. And this means if you have had one stroke, we need to tell you all the tools that you should have at your disposal for reducing your risk of having another one. There is primary stroke prevention, which is to keep you from having a stroke ever. And then we have secondary stroke prevention. This is after you have had one stroke, what is it that we can do to reduce your chances of having another one? Now, of course, it's obvious why we would not want you to have one, right? The more strokes you have, the more brain damage you're going to have, the more impairment you're going to have, the more disability you're going to have, the more fatigue you're going to have, the more psychological stress you're going to have, and the brain is less and less able to compensate. There is a cumulative impact of multiple strokes, and we really want to make sure that you understand everything you can reasonably doing to reduce this risk. Every year in the United States, there's at least 700,000 strokes that are due to ischemia. This is a blockage in the brain that prevents blood flow, and about 180,000 people have a stroke due to a hemorrhage. This is when there is bleeding in the brain, which is very stressful in the brain environment. We know that unfortunately after you've had one stroke, you are at a higher risk for going on to having another stroke. But what I want to do is demystify this information for you because I know a lot of you have anxiety about having another stroke, even to the point where it can lead to a little bit on the spectrum of post-traumatic stress disorder as it relates to stroke. So this is scanning your body constantly to see if you're having another sign of stroke. This is anytime you get reminded about a stroke, your stroke, a stroke on TV, hearing an ambulance, anything that reminds you of your specific situation, and feeling really triggered, having a lot of psychological anxiety. And so I want to let you know what is reasonable within your control that you can actually do to reduce this risk. So what actually is the risk? The risk is about an increase every year since you've had your stroke. You do have an increased risk of about 3 to 4% of having another one. So what this means is your first year you have a certain percentage, 3 to 4%. Then the next year it's going to go to about 6 to 8% and so on and so on. Why is this? Well, in part, you just have more aging, and the risk factors that you had that led you to have the stroke in the first place are probably getting worse over time. That is, unless, of course, you have identified them and you know exactly what to do to maximally control them. And that is the topic of our talk tonight. What are the risk factors for having another stroke? And what is it that I can teach you that you can then put into practice in your everyday life to reduce these risks? So when we think about in the first 2 years after a stroke, we think that the risk, like I said, is probably anywhere from about 8% to maybe about 11%. Once you get up to the 5-year mark, unfortunately, about 40% of people who have had one stroke will go on to have another. But this is before we really have gotten aggressive about secondary stroke prevention. Okay, and I bet a lot of you listening are actually at much less risk than 40% because here you are motivated to find out what does science have to say. You are health conscious. That is why you're here with us at I Care for Your Brain. You want to know everything that you can possibly do. After about 5 years of having had a stroke, about 24% of women and 42% of men will go on to have another stroke. And again, what we think is that this is mostly due to people who do not follow medical advice, don't know or don't implement evidence-based recommendations. If people did the things that we're going to talk about tonight, we think the risk of having a second stroke could be cut down by at least 80%. So that's why it made its way into our lecture series, because it's really that important. The percentage of risk right now of having a second stroke is as low as it's ever been in the history of recorded medicine. And this is due to several important advances that have been really being pushed since around 1970 that has focused on making sure that we are identifying the risks that go into a first stroke and what exactly can we do to make sure people are managing those well. Every few years, there are guidelines that are put out by the American Stroke Association, the Canadian Stroke Association, the American Heart Association, to help get medical doctors informed and to get those numbers of reoccurrence lower and lower. They come out about every 2 to 3 years in the United States. The last one that I could find that was put out was in 2014, called the Guidelines for the Prevention of Stroke in Patients with Stroke and Transient Ischemic Attack, or a TIA. These are guidelines for healthcare professionals. When I read through them, they are good, but I have to tell you, I was more impressed with the ones that came out in 2017 from the Canadian Stroke Association for best practices to prevent a second stroke. And I'm actually going to rely more heavily on their recommendations tonight because I just think they're a little bit more clear and more actionable. So before we have our lecture tonight, you know I got to give you a disclaimer, which is that this isn't personal medical advice. We're not doctor and patient, right? We're educator and student, in a sense, supporter, supportee. I'm here to give you information and empowerment that you need to use as your own best advocate to work with your medical doctors to identify your personal risks and get them reduced. I want you to listen to everything I have to say tonight, but you really need to put it into practice with the help of a medical professional. So the first thing you're going to do in reducing your stroke is find out exactly why it is you had your stroke in the first place. This will require personalized brain health care. This is why we are here meeting together, because I feel very strongly that we need to make brain health care more personal. And what do I mean by this? We have to do in-depth assessments on every person to find out why they had their specific brain health challenge, in this case a stroke. Many times it's not one risk factor. Many times it's many different risk factors. And until you know your specific reason, it's going to be really hard to know how to target your efforts to reduce that risk. Unfortunately, about 40% of people who have strokes never find out exactly why. They have a word for these folks. They're called cryptogenic strokes. It means we don't know. It remains a mystery. That's a lot. And when that's you, I think that's really hard and anxiety provoking, because you don't know what the heck it is you're supposed to be controlling, right? Of the strokes that we know why they happen, 90% of them can be traced back to these 10 risk factors, okay? The first one, the most influential health condition on any stroke, is high blood pressure, hypertension, okay? The blood vessels throughout our whole entire body and in our brain require a certain amount of pressure to get the blood flowing through. Too low is too little. Too high is too little, right? We want to be right in that sweet spot. And we're going to talk tonight about optimal blood pressure readings when you've already had a stroke. Different types of fats that are in the blood, typically high cholesterol, triglycerides, these kind of things can build up and build a clot, which either breaks off and travels throughout the body and gets caught up in the brain's blood vessels, or builds up in the specific blood vessels in the brain and makes blood unable to get through. Diabetes, right? Inactive lifestyle, a poor diet, being significantly overweight, smoking, cardiac issues like atrial fibrillation or hole in the heart. We're going to talk about that. Too much alcohol over a long period of time. And the final one is what we call psychosocial factors. This basically means that there is inequality in medical care, that being low income and low education, living alone, these are all bad for your health and increase your risk of stroke. There are some lesser common risk factors for stroke, including arterial dissection. This is responsible for less than about 2% of strokes, but it does account for about a quarter of the strokes that happen in young to middle-aged people. We know that a dissection relates to an abnormal and typically a abrupt formation of a tear inside the wall in an artery. As the tail becomes larger, forms a little bit of a small pouch, and blood starts to accumulate in this area and can lead to a stroke in a couple different ways. One is that it can get so big, that pool of blood in the artery, that it basically closes off blood flow from one section to the next. It can clot, which means it can form another type of a barrier, but sometimes it can leave one area of the body and travel through until it reaches a blood vessel that is small enough to where it gets trapped. Sometimes we can call this an artery to artery thromboembolism. And we know that these things typically happen in the vertebral arteries in the back of the neck. And we think that this is because when we move our neck, we typically get more wear and tear on those in the back. Another risk factor is the patent foramen ovale. We call this PFO typically. It is a term to describe a small heart that lies between the left and the right atrium. 1 in 4 people actually have this, but many people don't learn about it until they have had their stroke. So shortly after birth, many of us who have this, it closes naturally. It increases your risk of stroke by about 25%. There's also something called hyperhomocysteinemia, which is a medical condition that you have a high level of homocysteine in your blood. This is a common amino acid. A lot of people who eat a lot of meat actually have this in their blood, and it increases the risk of a thrombosis, a clot, or overall building up of arteriosclerosis in the blood. There's also something called a hypercoagulable state. This is basically sticky blood. It can be either acquired or inherited. And what we think of is if someone has a pulmonary embolism or a deep vein thrombosis, that breaks off and travels to the brain. There's also something called Antiphospholipid antibody syndrome. This is an autoimmune disorder that occurs if the body's immune systems make antibodies that go on to attack the tissues or the cells. These can cause blood clots. We know that sickle cell disease, unfortunately, increases the risk of stroke by the rigid red blood cells that ultimately get together and clump along the walls of the larger artery, like in the brain. We know that there's something called cerebral venous sinus thrombosis. This is actually a blood clot that can form in a group of your sinuses. We commonly think of sinuses as just kind of being here, and with allergy season here in North Carolina, we've seen a lot of people with stuffed up sinuses, but your sinuses are incredible. If you ever want to Google a picture of it, it's fascinating, but they're all in our skull cavity, and it's responsible, a lot of different blood channels to get fluids in and out of our brain. These can become infected, of course, and people can get a blood clot. The final risk to talk about is pregnancy. A lot of people, either through birth control pills or just the hormonal changes that happen in pregnancy, are at increased risk for stroke. So let's transition into talking about how can we reduce those risks. Well, most people who've had a stroke rarely just have one of those risk factors. They typically have multiple risk factors. And this is why we need to be both personalized and comprehensive, right? We know that millions of people would be saved from additional disability and decline, and millions of dollars could be saved if we really put a lot of education behind helping people not have a second stroke. So let's go through those guidelines. Remember, I said before high blood pressure was the #1 risk factor. Well, this is probably due to the impact of the inside lining of blood vessels, and high blood pressure can really tear away and leave little deposits where the cholesterol plaques can start to form. And over time, once you get an episode of high blood pressure, the friction and the velocity of the blood moving through can make those little hard crystals, the clumps on the side of the cholesterol, break off. And when they move downstream, that can cause a blockage in the arteries. So what we know is that very small changes in blood pressure can make a really big difference in your chances of having a second stroke. So they looked at one study where there were people who had 133/76 and compared them to 140/81, and just that little change, so 140 to 133 and 76 to 81, just those couple little numbers reduced the risk of stroke by 27%. And these are people who had had a stroke and were trying not to have another one. That's pretty good. What we actually know for people who have had a stroke is that we want to try to get the blood pressure down to about 120. Most people get recommended to be at 130 or 140, but this is because we know that many people who get put on many blood pressure medications can actually go too low, and poor circulation, poor blood flow is actually just as bad to the brain as too high. So the recommendation is actually to have it be around 120. There is not one medication for high blood pressure that's any better than the other, but what we know is it can't just be you relying on pills. This is where sodium restriction comes in, not having enough salt, the Mediterranean diet, low-fat dairy products, low meat, limited alcohol consumption, and regular physical movement. All of these things have to be done together. Next one is diabetes. So if you had diabetes, if you have it and you had a stroke, you want to be on top of this condition as much as you can. Diabetes hurts the brain in many ways, but we think of inflammation primarily, the production of free radicals, there's cellular damage, you're much more likely to have buildup in your arteries. If you have had diabetes for 10 years, this triples your risk of having a stroke. About 25 to 45% of people who've had a stroke or a transient ischemic attack, a TIA, had diabetes going into their first stroke. So when you have diabetes, that does increase your risk of having a secondary stroke by about 1.6 times. We know that, of course, lifestyle modifications are key. We want your A1C to be less than 6.5. It's going to take some work to get it there, but we also know we really want to keep your cholesterol levels and your blood pressure in extra good check if you have diabetes. It makes those things even more important. And so there's something called the Action to Control Cardiovascular Risk in Diabetes blood pressure trial, and they were able to show us that intensive control of blood pressure when you have diabetes can reduce your stroke risk by over 40%. So what I want you to hear me say tonight is it's not just about one risk factor. You have to identify all your different risk factors and simultaneously go after them together to be able to bring this risk down. We know that, like I said before, fats in the blood, they call this dyslipidemia, is a big risk factor for another one. High levels of cholesterol specifically increase your risk of an ischemic stroke, so having a blockage. We know that when we do what we call aggressive statin therapy, this can reduce the risk of stroke by about 21%. That's pretty good. You want to strive to have your LDL less than 190. The next risk factor is AFib, atrial fibrillation. This is a very big risk factor for strokes. We think about 10 to 12% of strokes are caused by AFib, and the main cause is a cardioembolic stroke. So this is where you have a little quivering in the heart in the time that it is taking extra to be able to contract. A little bit of a blood clot can form. And when the heart is able to get back in rhythm and contract, it basically shoots out and goes all the way up until it can't go anymore, and it finds its way into the blood vessels that are tapered smaller and smaller and smaller. So depending on the clot and how small the blood vessel is that it gets into, that's where you're going to have your stroke. And what we know is that everything that doesn't get enough blood, therefore oxygen and glucose, which are the fuels of the brain, this is where you're going to have the cellular damage. We also know that PFO closure is a big part of helping people minimize the episodes that they're going to have with AFib. So a lot of people go through that surgical procedure to heal that small heart in the hole between the left and the right atrium. Anticoagulation therapy is very important. This is blood thinners. So these are the chemical substances that can prevent or reduce stickiness, coagulation of the blood, and also prolong the clotting time. So it just takes you, because we do not want to lose our our ability to clot our blood completely, because you'd never stop bleeding, right? But we do know that we can help that process take longer and not be so immediate. These are things like heparin and warfarin. There's also something called antiplatelet therapy. So a lot of times people get put on anticoagulation, the blood thinners, but we also know that there's another group of medicines, and this is where aspirin falls in, that we know that helps the platelets in the blood stop from sticking together, and it's another way of forming a blood clot. So many times aspirin, full dose aspirin is given within a few days of having an ischemic stroke, and we think that that significantly reduces the reduction in that hospital stay time. There's also surgical procedures. There are carotid endarterectomies and there are carotid artery stenting. So two of the main blood vessels going into the brain are right here, your carotid arteries. They're about the width of your pointer fingers on each time. And many people have blockages in here, and a little piece can break off, and that can be part of why someone has an ischemic stroke. And so if that's identified as the risk factor and you're not too little blocked up and you're not too much blocked up, they might actually go in and strip out some of the cholesterol. So if you're less than 50%, they don't like to do it. If you're more than 99%, they don't like to do it. But if you are 50 to 79% and you've had a stroke, or you're between 80 and 95%, they're typically going to go in and try to open up that the wall of the artery and actually strip out the tube of cholesterol that is stuck in there. For patients older than the age of 70, we think that the endarterectomy is easier than the stenting. What the stenting is basically taking a long hollow tube called a catheter and basically putting it in there and then pushing all of the junky stuff, the cholesterol, over to the side. And the goal, of course, is better blood flow all the way through. But, you know, we don't want to forget about lifestyle modifications. This is really the cornerstone of secondary prevention of another stroke. This is all the hard work stuff. This is your diet, your exercise, your weight, your alcohol, your smoking, the sodium. So let me go through some of those with you so you know all the tools that you can have at your disposal. Well, last week before, we talked about the MIND diet. This is Mediterranean Intervention for Neurodegenerative Delay. It is a mouthful. It is the Mediterranean diet and the DASH diet combined together with the additional wisdom of smaller studies that were done on specific ingredients for brain health. So this is a whole food, mostly plant-based diet, but allows for one fish serving a week, a couple different poultry servings, healthy fats like olive oils, nuts. It focuses on berries. It tries to have people use low saturated fats like butter. Very important that you think about what it is you're actually putting into your body. So many stroke risks are related to too much fat in the system. So it's really important to make sure you're putting healthy fats into your body. Sodium, salt, that little miracle stuff that we put on almost everything we eat that just brings out the flavor so nicely. You want to make sure if you've had a stroke to keep your intake less than, ideally, 1,500 milligrams per day. 2,000 would be the absolute max, but you want to try to keep it underneath the 1,500. We all know that smoking is not good, right? Smoking makes you twice as likely to die if you have a stroke. The more you smoke, the higher risk you are for having a stroke. Tobacco smoke has very negative effects on the body, including thickening the blood, increasing the risk of blood clots, narrowing the arteries, restricting oxygen, and never mind all the other junk that is actually in tobacco cigarettes, right? There's all sorts of chemicals that we don't even know about. If someone quits smoking after a stroke, you really see the benefit in about 2 to 4 years down the road. So that's really good information to know. You want to really avoid secondhand smoke. It's not just a matter of being around yourself as a smoker, but you want to make sure if your spouse or a parent smokes that they really understand this could be increasing your risk of having another stroke, and you don't want that, right? Physical activities is absolutely critical. Physically active people have a 25 to 30% less likelihood of having a second stroke. This is important. As you are able, adults should have moderate exercise. What does this mean? This is 4 days a week. You are moving at least 40 minutes per day. When you are significantly overweight, this increases your risk of an ischemic stroke by about 22%, right? We don't like that. We want to make sure that number is low, low, low. The next one is alcohol. Alcohol is very interesting because the effect of alcohol on the brain has what we call a J-shaped curve, which means 1 glass of alcohol a day is actually thought to be healthy for your brain. This is thought to be good. Anything more, especially beyond 3, is thought to significantly impact your risk of brain damage and also your risk of having another stroke. This is particularly true if you have that high blood pressure, if you have a diabetes issue, if you have a Fib. So if you're in that category, you need to be extra careful with alcohol. What we think is up to 1 drink a day max for women, up to 2 a day for men, but you don't want to drink every single day, actually. We think 7 per week is a really good rule of thumb for most people to abide by. So what do we know works? How do we get this information to people? Well, what we know is there's evidence to suggest that the best thing is to start talking about stroke prevention as soon as we have people in the hospital, ASAP. There was a research study that was done where they looked at people who got counseling about their specific risk factor in the hospital when they were there for their acute care. They followed them in 90 days to check on how good were they be at following instructions. And they found 100% of people were taking their antithrombotics, right? So this is your warfarin, your heparin, to keep their blood from being sticky and forming a clot. 99% of people were compliant with the recommendation to take a statin. That's to reduce your cholesterol. Awareness of the importance of calling 911 in response to possible stroke symptoms was 87%. Adherence to diet was about 78%, and adherence to exercise guidelines was only about 70%. Of the 24 people that smoked in this study, 20 of them, 83%, were not smoking when they checked on them in 90 days. Now, what is a little funny about this study is, you tell me, because you know better than me, was the time when you were in the hospital the best time for you to get new information? Or do you think that maybe you were overwhelmed, you were a little out of it, there were new meds coming into your system, old meds quickly going out of your system? Not sure it's the most realistic time to overwhelm people with information. Typically, there is a psychological response to having a stroke, and people are scared, people are upset, there's confusion, there's a lot of new faces coming and going. Might not necessarily be the best time. There was another study in the Netherlands where they set up a support system on the internet where they gave people personalized risk assessments for determining what was their exact cause of the stroke. And then they were able to log in and write notes to a nurse practitioner who then sent them back personalized studies. And they were able to get the risk of a second stroke down by about 14%. So what does this tell us? This tells us, we need personalized brain health care. We need human interaction, right? I wonder how far they would have gotten with that study if instead of being an internet program that they actually had real medical providers interacting with these people. I bet that would have gotten it up a little bit higher. But what we know is so critical is that you advocate to find out for yourself what were your specific risk factors for stroke, and you want to go after those things as informed and as aggressively as you possibly can. That's what's going to get your personal risk factor for stroke down, okay? The 10 that I talked about tonight, these are the most applicable to the most people, but they're not you, right? You're a very unique person who has your own unique risk factors. So once again, I gotta tell you, neuropsychologists are really good at this stuff. This is what we do. This is what we care about. We are very committed to personalized brain health care, partnering with you, respecting the fact that you are an expert in your own right. We have our own expertise. Hopefully those two levels of wisdom can come together and we can actually get somewhere in this brain health recovery journey that you are on. So I will be back April 24th talking about post-stroke depression. This is such an important topic because so many people can have symptoms of depression that either come from the biology of the changes that have happened in their brain from stroke, or all of the intense psychological and social things that can happen when you've had an abrupt traumatic experience with a change of function. So I want you guys to understand what it is, how it can interfere with your recovery, how it might be adding an additional layer of disability to the problems that you're already experiencing just from stroke, and how successful treatment can be. You deserve the very best outcome that you can possibly get. I would so appreciate any likes and shares on this post. It's really important to me that we connect with as many people out there in the world who need this information. And I am starting to think about my topics for May. We're going to actually stick with stroke because we have a big announcement coming out in another couple of weeks. That is the culmination of an entire year's worth of very, very hard work, and it relates to stroke. So I want to get everybody good and educated so we can talk about the release of this really important project in a few weeks. So thank you guys so much. Always appreciate your time and attention very much, and I'll see you next time. Bye-bye.